forensic traumatology distinguish 4 types of mechanism action of a blunt object. This blow, or in English present next name, hit, stroke. Next, clench, other name, compression or squeezing, stretching, and friction. If take blow, my dear friends, remember, in lecture in mixed learning present this definition, this action with short time, yes, very quickly, short action under right angle. Under right angle, because if take acute angle, this friction. So, due to blow, if take hand, my dear friends, this blunt object with flat limited surface. In this situation, you can see injury as a bruise. Remember, our topic: bruise is a hemorrhage without trauma of skin length. Look, trauma of the skin is absent, but present hemorrhage into soft tissue and into dermis, which is formed due to rupture of blood vessels, which is formed due to blow or clench blunt object with different surface. Next, my dear friends, look, due to blow maybe is formed wound. Look, repeat photo, blow of blunt object with flat limited surface. Next, look, you can see wound which is formed due to a blow blunt object with cylindrical surface. Look, you can see blood infiltration zone, abrasion zone, irregular edges without wound canal, this injury. And look, you can see wound with two which is formed due to action of a blunt object with angle. Look, with angle as a table, angle of the table. Look. So next, due to blow with maximum force, large force, into bone is formed as a direct and indirect fracture. Direct, indirect fracture. Remember, direct fracture as the name local fracture. This fracture is formed in place where was contact, traumatic object with body. As a result, this fracture name direct. Indirect fracture is formed due to blow and due to clench, and this fracture is formed on distance. Look, in this zone was blow, but fracture is formed on distance. As a result, this fracture name indirect. Next type traumatic mechanism, clench or compression or squeezing. Main sign for clench, this deformation of the body. Look, you can see squeezing, example with squeezing or clench body between ground, this blunt object with flat prevailing surface, and the car, flow of car. As a result, you can see example with clench body flat prevailing surface.
Don't say microphone.
So microphone. So and in this case is formed the deformation of the body with trauma as a bone tissue, as a inner organs, and the soft tissue. And look into skin due to clench. In case with run over, traffic accident, run over by wheel of a car, is formed a hemorrhage. And look, this hemorrhage have a rhomb-shaped form and repeat protector of a wheel of a car, Next, stretching. My dear friends, look, now I show photo with traffic accident, run over by wheel of a car. You can see imprint protector as a deposit of dirt. And look, you can see laceration wound with trauma as a skin, as a hypodermis, muscle tissue, ligamentum, and with trauma of as a cartilage and bone tissue. Friction. Now, remember, friction is formed due to sliding body and surface of the traumatic object, or due to sliding action of a traumatic object at body under acute angle. Because if take right angle, this blow action name blow. So in our life, in most cases, you can see mechanical injury which is formed due to friction, this abrasion, scratches, and due to blow. This bruise, wound, fracture, trauma of inner organs, bone dislocation. This injury named anatomical injury. And in our classification, present second group of injuries is functional injury. If take functional injury, my dear friends, this pain. No, in all situations with trauma, in our organism is formed acute sharp pain. Next, edema, next, hyperthermia, hyperemia, and loss of function. But first, pain. Next, functional injuries is shock, and the confusion of the brain, maybe heart, maybe lung, and other organs. Paralysis, is functional injury too. So, my dear friends, next information in our in our topic, this characteristic as abrasion, scratches, bruise, wound, and fracture. No, so first step, remember histology. Normal histology, structure of the skin. In our skin, distinguish three layers. This epidermis, dermis, and hypodermis. And help me, my dear friends, help me now. Give me answer on my question. Name specific sign for epidermis, epithelium tissue, specific sign.
Skin.
Epidermis.
Ma'am, like
Presence of skin.
This outer layer of the skin, yes, outer external layer, but be interested as specific.
Sometimes contain hairs or something, pores.
So, I change question. Specific sign for epithelium tissue, because epidermis, this epithelium tissue, yes? I wait answer. Specific sign for epithelium tissue. What component is absent in epithelium?
Muscular? No.
Vascular vessels, absence of blood vessels.
Yes, of course. Yes, of course. My dear friends, you're very good students, really, doctor. So, my dear friends, yes, in epidermis is absent blood vessels, but present lymph vessels. Blood vessels locate into dermis. And remember, dermis have a papilla layer which locate under epidermis, and a reticular layer which locate more deep. So, and if take epidermis, look, this structure of epidermis, in epidermis, blood vessels is absent. But I repeat, present lymph vessels. As a result, due to trauma of epidermis with papilla layer of dermis where present small capillaries, you can see superficial injury which named abrasion with a red color, because this injury perforated more deep into papilla layer of dermis. So, if abrasion have yellow color, as in this situation, look, yellow color, This abrasion penetrate only into epidermis without trauma of papilla layer of dermis. As a result, this injury have yellow color because in epidermis, blood vessels is absent but present lymph vessels. As a result, you can see on the surface of this injury lymph with yellow color. So, and my dear friends, in epidermis distinguished fifth layers. This stratum corneum, lucidum, granulosum, spinosum, and basal stratum. My dear friends, remember, into epidermis present specific cells, these melanocytes. In these cells present specific pigment, this pigment named melanin. This pigment name color our skin. As a result, due to trauma of epidermis, is formed destruction of melanocytes with melanin. As a result, in phase number 4, with abrasion, you can see final phase, you can see the spot, depigmentation spot. Depigmentation. Yes, in this place, in fourth phase, is formed new epidermis. But, my dear friends, melanocytes, very slow regeneration. Very slow. As a result, you can see in epidermis this spot, the pigmentation spot. If take a child, no maximum 3 months. If take our age, no, as a minimum 6 months. If take old man or woman, the pigmentation spots are present few years, because melanocytes in this age very slow regeneration. So next, my dear friends, remember, abrasion, this superficial injury, I repeat, abrasion, superficial injury in most cases is formed due to friction with irregular form. This local injury, in all cases is formed in place where was contact, traumatic surface with the skin. And maybe is formed scratches. Look, with abrasion, on base of abrasion, you can see scratches. Scratches in all situations have line form, and they penetrate more deep as abrasion into papilla layer of the skin. As a result, look, scratches in most cases have a red color, dark red color, brown red color, because this injury penetrates as into epidermis and the papilla layer of dermis. And my dear friends, remember, in case with abrasion, distinguish 4 phases. First phase, this initial stage, and look, you can see fresh injury. Look, without epidermis in center. On periphery, this injury, this defect of skin is formed edema, and look, hyperemia. As a result, this injury is formed intravitally, and look, defect, surface of defect locate below healthy skin, because in this place is absent epidermis, as a minimum epidermis, and on periphery in healthy skin is formed edema. As a result, surface locate below healthy skin. Next, second stage, formation of a scab. Look, you can see structure with dense consistency, dark brown color. This structure closed defect of the skin. And look, in second stage, it start regeneration of lymph vessels and the blood vessels, and look, around this injury, a sign of inflammation is absent, because in second stage start regeneration of lymph vessels and the blood circulation. Next, third phase, epithelialization under scalp. Look, you can see scalp, but in this situation, this scalp located above healthy skin. Why? Because under scalp is formed new epidermis, new epithelium tissue, and this tissue is formed first on periphery. As a result, you can see disclamation of a scalp on periphery. Why? Because in center, this injury more deep. And the final stage, depigmentation stage, depigmentation, you can see depigmentation spots. In this place present new epidermis, but without melanocytes, because melanocytes very slow regeneration and the slow accumulation melanin. So next, this example with abrasion too. You can see example with mechanical asphyxia, hanging. This negative imprint, which is formed due to clenched loop on the face of the skin. This injury name strangulation mark. If take this mark as an anatomical injury, this abrasion. As a result, the face of strangulation mark have a dark brown color and dense consistency. Next, you can see Stans mark, around of a gunshot injury, entrance wound. Stans mark, this imprint is a face of firearm, which is formed due to hermetic contact of the face of firearm with epidermis, hermetic contact with epidermis. Due to shot is formed at contact distance is formed Stans mark imprint of firearm. If take this imprint as an anatomical injury, this abrasion, because this trauma of the epidermis. Next anatomical injury, my dear friends, this bruise. Look on this diagram. I show diagram with bruise and the wound. Look. In case with wound, present trauma as epidermis, dermis, hypodermis, and this injury penetrate more deep, maybe in muscle tissue, maybe into cavity with trauma inner organs. In case with bruise, trauma of skin is absent. Ulceration. Next, alteration. And you can see a hemorrhage into skin. Mechanism formation hemorrhage in this situation. This hemorrhage is formed due to rupture of blood vessels. Why is formed rupture? Rupture of blood vessels is formed due to blow with large force or due to clench with large force, maybe at fixation of victim. My dear friends, I have 1 minute in Zoom program. Please re-enter now. Re-enter in Zoom program altogether.